The following program is classified G. It's suitable for all ages. We would like to remind our viewers that the views expressed in this program by our participating guests are solely viewpoints of them who take part and does not reflect the views and beliefs of the Derana Media Network. This is Ada Derana's continuing coverage on the coronavirus crisis.
A very warm welcome to all our viewers on Gen XYZ. Before we start our program, a very happy new year, a prosperous new year, and above all, a safe new year to all Sri Lankans and all our viewers from around the world that are joining us. Today we are going to discuss something very important when it comes to the state and our response to the coronavirus pandemic, which even the WHO has considered as recommended to most other states. So we really need to identify what is this influence that technology has taken on how we as a nation are responding to the coronavirus. And we have brought two individuals who will do exactly that and tell us the kind of innovative steps that they have taken in their own capacity. So I'm joined today by Dr. Ashan Pathirana from the Health Promotion Bureau and Dr. Harsh Jayakodi, who is the founder of My Doctor. Dr. Harsh is, in fact, not a new person to Derana. He has been with us. So Dr. Ashan, let's get into the discussion directly. If you could give us your take on how the state has been functioning, how the Health Promotion Bureau, which we are going to give in a lot of information that a lot of people haven't heard for quite some time, over the decades, that people have been focusing on the medical aspect and they haven't really identified the kind of work that the Health Promotion Bureau and in fact the IT industry, I think, with applications like My Doctor are doing behind the scenes. So Doctor, if you could, firstly, let's take a general take of the entire issue and then we'll move on to these technicalities. Dr. Asha?
So about the coronavirus itself, we have to all understand the fact that the virus is quite novel to everyone. So it keeps evolving. That's why a lot of people find it very difficult to understand, okay, the advice that has been given even by the WHO keeps changing over time. Because we have to all understand that the virus is only about 4 months old. So as we learn new things, we need to start adapting towards understanding this virus and the protocols will keep changing. So right now, Sri Lanka is doing a great job in handling this because compared to the other countries which reach the 100 patients number, we have not grown exponentially. There is a reason behind it. The reason is the commitment that we have had throughout the commanding chain in Sri Lanka, starting with the political commitment to the health system and to the people. So the people, even though we've been seeing a lot of wrong things, do not generalize that, because the majority of the Sri Lankans have been very responsible in the way that they have handled it, and the credit should go to the entire system. So.
All right, Doctor, I think that's a very good place to start. Dr. Harsh Jayakodi, if we could, I know that there are a lot of details that we have to, really discuss today pertaining to the kind of work that you have been doing, about the kind of facilities that have been created through My Doctor and then even to the hotline, if we could get some time there. Doctor, as an initial point, how do you take, what is your reading of the entire situation today? What do you think that we are doing right? What do you think we are doing false? And where are we heading with the current system that is in place, both by the state and by private entities?
Yeah, as Dr. Ashan told, I think Sri Lanka is doing very well according to if we see the Western countries, which we were believing that they were having very good health systems. But I think they have failed because they don't know what to do, and we have seen the corridors of those hospitals are filled with patients, and even the critical patients are managed at home because they don't know how to handle it. But in Sri Lanka, I think we have, with the, as you told, as Dr. Ashan told, with the government involvement, with the health system involvement, even the Triforce's involvement, we have been able to manage this. So up to today, up to now, we have only 218 cases identified, which is a very good thing because we reached the 100 mark, and I think within first 7 days,
it's supposed to double.
Yeah, I think we were able to manage it.
Yeah.
So I think as a country with a very good health system, which has been even praised by the WHO, we have been managing this situation very well. And as a technical aspect, I think the tech also have played a huge role here. So we'll talk about it.
Yeah, I think that is exactly the kind of introduction that is required. We really need to talk about how we, as a small country, have been utilizing the resources we have in this industry, Indian industry that wasn't, let's say, popular. Like not a lot of people knew that we had this kind of potential. So I think that is where Dr. Harsha's entire argument becomes very important. Doctor, if you could, I think the discussion should now evolve into really understanding what are the key elements within the Health Promotion Bureau that they have been taking steps, be it to monitor the social media, because information is becoming one of the most key elements that people should be aware of. Doctor, give us your take on exactly the kind of steps the Health Promotion Bureau is taking.
Yeah. So I think even at the very beginning, the WHO chief mentioned that the virus itself is causing an epidemic, but the misinformation is causing an infodemic, which can even be worse than the virus itself. Because a lot of people have opinions, this is a new thing, people are scared, some people want to take advantage of it. So with all that in the picture, social media was going to play a crucial role. So as we all know, like, we have experienced how the social media was shut down in Sri Lanka during certain episodes. So it's a very powerful tool. If you use it properly, it can be used for the benefit. So to manage this health misinformation, I think the most crucial part was the appointment of independent fact checkers by the Facebook company itself. So Facebook is the most powerful platform right now in Sri Lanka because we have about 6.5 million active monthly users logging into Facebook. So we knew how it was used for the elections and everything. So there is no reason why we should not use this to propagate the correct health messages. So the advantage here was we were given the task of verifying information for the company itself. So there are independent fact checkers who would call us and check whether the misinformation is circulating. So we have our social media listening tools where we can see what type of messages are being circulated, if there is anything wrong. So we can rectify those things. So people might have seen already in Sri Lanka when there are misinformation, the Facebook does not only take it down, they put a mask on top of it. And in that mask it says this misinformation is tagged because of this particular reason. And if you want to get the correct information, this is the link to go and check it. So this is the level that we have reached to correct the social media landscape in Sri Lanka so that people will start understanding to use this responsibly. So a lot of work is being done behind the scenes. This is not the only platform that we are using either. So the web page, the tech going behind it, and the private sector involvement, it's unimaginable. Right? During these crisis time periods, I think the Sri Lankans come out with their true nature. We saw it during the 2004, during the tsunami, we saw how our people came forward and unified for a common task. I think we can see that again. The young innovators, the tech guys, everyone is coming forward to give their contribution towards this. And it's, I would like to say that it's not just us. It's the entire country, the private sector, everyone has come together to help us in this.
Right, Doctor, I think that is something that we need to take in the next few segments, exactly the kind of involvement the private sector has come up with. Dr. Harsha, if I go to you, I think the baton that we can take from this discussion is something that you are fighting for also, is to provide information, is to provide this consultation that is required in this time of need. And for that, Doctor, I think you have brought in this concept of telemedicine, and that has been improving day by day, and you have taken steps to bring it to the people. Could you give the viewers, I think it will be great for first segment to really take and properly identify what telemedicine is, Doctor. Could you give us an introduction?
Yes, Dandu. Telemedicine is actually a Greek word. Tele means distance, and medicine means you provide health services. So telemedicine is you provide health services from a distance. So this has been there since a long time. Even we know in the 19th century when the telephone was discovered. So that is the time of era which this telemedicine was introduced actually, where the information, health information was passed through this telephone. So that is the initiation of telemedicine. Then it was slowly growing. And then in 1960s, with the use of television, I think it was the first teleconsultation was done in UK, especially in a psychiatric hospital, where it was used to talk to psychiatric patients, where doctors sometimes can't go near the patients. So this was the first initiation of teleconsultation. So from there up to now it has developed. So with the new mobile technologies, as Dr. Ashan told, lot of new technologies developing, this telemedicine has developed in such a way. So especially the audio calls, video calls, where you can then and there talk to a doctor through these platforms. So this has taken telemedicine to a different level. Especially in all the Western countries, we have seen this telemedicine was practiced, especially in USA, Canada, Australia and UK, even the NHS practice this telemedicine. But in our countries it is not very, actually was not very much practiced, though it was there. Because our people use for this physical touch and they used to see it in a different way. But now it has come where the people will recognize this telemedicine as a very essential service. Also to add where artificial intelligence and other sorts of new improvements also have been involved with this telemedicine, where this big data is used for predictions and used for very much researchers and a lot of other things, where telemedicine has now been recognized as a very good system to overcome certain barriers in medicine.
I think there's a very good place to end our first portion. The first portion of our discussion. We'll go for a break and we'll talk about, like in detail, what are the outlets of telemedication and how it has come out to the people of our country. So on that note, we'll take a very short break. You're with Gen XYZ. Stay with us.
This is Ada Derana's continuing coverage on the coronavirus crisis. This is Ada Derana's continuing coverage on the coronavirus crisis.
We are back on Gen XYZ. We are moving to a very interesting part of this discussion, and we'll start with Dr. Ashan. Now, Dr. Harsha gave us a very good elaboration of what telemedicine is. And Dr. Ashan, if you could tell us, now the people should receive this, the information, the capacity to go and function in the environment through internet, through like mobile means, and they have to be literate in those facilities. So the next question that someone who's looking at the program would understand is, will people really understand it? So Doctor, since you have hands-on experience with like talking to people and working with people, how have people been working with you? Like, what is the reception? What has the reception been like?
Okay. So people have been very receptive because it's a transition. Sri Lanka is in a transition period, and nearly 40% to 47% of people are using smartphones these days. So telecommunication is growing rapidly, and Sri Lanka is a country that has this adaptability at a very high rate. So as soon as the infrastructure moves in, people will get adapted, and we can see a lot of people utilizing this platform. For instance, for the last 30 days, the reach from the Health Promotion Bureau Facebook page has been about 5 million, right? So the number of followers have raised to about 400,000. So you can see how much of people are turning up looking for information. So yesterday, a lot of people might have seen, we released a music video thanking the people for the way that they have behaved and the help that they are giving the government to control this measure, and the reception has been amazing. When I checked in the morning, it's about 2 million hits on that video. So you can see people are coming to these sources looking for information, and it's up to us to empower them to use it in the correct way. It's just like having a fast car. You can use it for the best purpose to transport people or to transport a patient, but at the same time, if somebody misuses it, it can cause accidents. So just like that, this is good technology that's been developed and people are getting on board. But if you don't teach them the correct way of using this responsibly without getting attracted towards the false information, misinformation, thinking that everything that they see on the internet is true, I think we have got a good start. We need to ensure that these things are taught for kids at a very early age on the responsible use of technology, so that one day Sri Lanka will be one of the most technologically advanced countries, because Sri Lanka has some of the best innovators in the world in terms of IT. I think my IT department people would be able to say that most of the good coding people are from Sri Lanka. Some of the most powerful economies are functioning through Sri Lanka. So we have a lot of potential. Our people will fall in line.
I think a similar question to you as well, Dr. Harsha. How can, in your line as well, these kind of innovations, these kind of mechanisms that use IT in particular be implemented in this country, be introduced to the modern world, be used in discussion, be used to such an extent that people are using these outlets to get the information? Because when it comes to Facebook, like it or not, there is a lot of misinformation that is spreading. And measures such as the one you are taking are trying to curb those kind of that kind of interest being spread, but rather something more credible. So, doctor, what is your take on this? How are people being receptive to these outlets?
Yeah, as Dr. Ashan told, I think people are using Facebook. A lot of people are using Facebook, but sometimes it may be due to just gossip, to find out gossips and those things. But it's very rare until very recent. People didn't use Facebook for this health information. But with this coronavirus, I think it has changed. Now people is using this social media. People are using this social media to get this health information, which is a very good thing, I think, which happened with this corona pandemic.
True.
So not only Facebook, even the Twitter and other sort of social media is being used for this to get good, correct information. So that is a very good thing that where Sri Lankans are using this social media to update their knowledge, to get used about this preventive measures, and to know about the world, what is happening in the other world, and to see how Sri Lanka is going on. So everything is now there in just your smartphone. So I think as a country, Sri Lanka has used this opportunity to create a lot of good in this social media also.
Doctor, on that note, doctor, if I were to extend on that and move to your specialty in this as well, doctor, on telemedicine, how do you think the people in this country, if they are to be receptive, if they are to reach out, if they are to follow more digital means of getting their information, how can it help suppress COVID-19 in particular when it comes to telemedicine, doctor? What are the approaches?
So in general, we'll see how in a pandemic like COVID-19, how telemedicine can be used. So Darindu, in a pandemic situation, people can't go to see a doctor sometimes, right? But people are getting ill. Even we know how the hospitals, even the private clinics during the evening, how crowded they are. But now we don't see that, right? So people may be using good health measures, maybe that was reducing the disease, but actually people need to go to a doctor, but they can't go to a doctor. They need to go to a hospital, but they can't. They are in a fear of going. So the telemedicine plays a large role here. So telemedicine can be used as a platform to speak to these people. It can reach to these people. In a COVID-19 pandemic, what has happened is the accessibility and the availability of health sources has been reduced because people can't access a doctor and the doctors are not available. Not only doctors, even the other healthcare professionals also. So these telemedicine platforms make this accessibility, create the accessibility towards these healthcare professionals and even the other stakeholders like pharmacies, laboratories, like those. So with this COVID-19, so people can use this telemedicine platform to speak to these doctors. So they don't need to physically go and meet a doctor. So these platforms enable them to talk even from a distance. Even the doctor or the consultant specialist may be 100 miles away from the patient. But through this video conferencing, audio conferencing, they can talk to the doctor and get their doubts cleared. And even they can get their symptoms assessed, because symptom assessing is a need actually. So they may want to know, I have got these type of symptoms, do I have corona? So they can use these platforms to clear their doubts. And even they will not like to know about their family members or some other relatives having these type of symptoms. So is it that, because they may have doubts because that person may have visited. So they want to get doubts clear because they don't know how to do it, because they can't go out, they can't speak to any other doctor. So these platforms can be used for those things. And also for larger screening facilities, especially when you have large populations where you need to screen and categorize patients, categorize population, whether they are exposed, whether they need to go and visit a hospital. So these type of categorization screening also can be done through these telemedicine platforms. So those are the main things. And also, as Dr. Ashan told, the health education plays a larger role here. So these platforms also can be used for health education. So through video, through audio, this health education also plays a larger role.
Doctor, on that note, before we go into a very small break, if you could tell us in brief, Dr. Ashan, I think taking these ideas that Dr. Harsha is mentioning as well on like the availability of these resources at this point. So I think the next few segments will devote to the kind of private entities that are involved with your. Doctor, what are the concrete mechanisms that are in place to spot this, fake news from spreading, as Dr. Harsh also mentioned, because people are vulnerable, they're in their homes, and that is particularly what he was mentioning about how when they're at their homes, this social media and these are the means that can be used. Are there any particular mechanisms through which the Health Promotion Bureau is involved to spotting fake news, or the kind of procedure that is involved there, Doctor? If you could shed some light on that.
Okay, so this is a very good question, because there is a social responsibility. See, we all expect regulations to come from the top, saying us how to live and how to do things, but there is a community responsibility to do the right thing. So we expect people to do the right thing, but when they don't, we have the social media listening platforms where we can see the new trends that are taking place, and we can see if something false is catching up. And apart from that, there are people complaining directly to us, saying that there is health misinformation. So that is one way of doing it, because it's social policing. People detect that there is some problem, they forward it to us, and then we review it with the fact checkers and see if there is a scientific basis or not. And then through meticulous scientific investigation, we will decide whether it is false or not. So there are community standards set by various organizations, including Facebook, which if it's violated, will be removed from Facebook. So they keep watch. They have independent fact checkers. Apart from that, they have AI, artificial intelligence, to screen hate speech, to see if there is anything that violates the law of the country. If anything comes up like that, it will be immediately taken down by the artificial intelligence in their system itself. But if we report something, there can be a reviewer, a human being reviewing it and removing it. So.
All right, and those are the kind of mechanisms that are in place.
Absolutely.
I think that's very important to our viewers as well, because most people, they are aware of something that is happening, but then they really didn't know the procedure. So on that note, we will take a very short break. We are in discussion with two very important people who are giving us the kind of insight that the more online based, more mobile version of how we can get our information and be aware of how to battle this specific virus. On that note, we will go into more details. Stay with us here with Gen XYZ.
This is Ada Derana's continuing coverage on the coronavirus crisis. This is Ada Derana's continuing coverage on the coronavirus crisis.
Back on Gen XYZ, I think we have come to the point of discussing the kind of the state's involvement in all of this, and really understanding how the state can work around private entities, because we have seen this in nations such as China, for example, who resorted to means such as Alibaba to get their resources spread around, and so most people would assume that in Sri Lanka that cannot be done, but I think you have mentioned otherwise. Dr. Harsha, something that I would like to ask from you is, now, since you have advocated for telemedicine for quite some time, and then you're working on behalf of that, bringing these resources predominantly for the people's use, of the ease of the people, could you tell us the kind of state initiatives that are taking place? Like, how are you working with the state, and how is it going forward from that point?
Yes, Narendra. In the Health Ministry of Health, there's a special unit called Health Information Unit. So in the Health Information Unit, head by Director Health Information, Dr. Anil Samaranayake. So Dr. Anil Samaranayake and also with the ICTA get together with the doctors, health informatics doctors. We have a separate segment of doctors who have qualified in health informatics in Sri Lanka. Sri Lanka is the only country other than USA which has doctors qualified in health informatics. So these doctors get together with the health information unit, and also with the ICTA backup. They have developed an app for this kind of what you call the requirement. So it's called My Health Sri Lanka app, which has been launched last week. So through this app, actually it's a government initiative with the Health Ministry and the ICTA. So with this app, people can download the app free and get a lot of information with the Health Promotion Bureau APIs where they can get information as well as they can speak to a doctor free of charge through platforms in private entities which are plug into this app. So one is My Doctor as well as this other partner called ODoc. So these two platforms are plug-in where people can talk to a doctor through this platform, a teleconsultation. So this is a very good initiative done by the government at the need actually, and also it will give the access to people. People use smartphone for various things, but this is a very good thing where people can use the smartphone to talk to a doctor to get their health advice free of charge.
I think that is what is most important at this point in time. Dr. Harsh also mentioned when he came to our previous program that most of these services are completely free of charge, that people are allowed to move into these consultations or at those points and those requirements. I think on that specific note, Doctor, if I come to Dr. Ashan, you gave me a very good elaboration before we started the program on how the private entities are also involved in creating, as Dr. Harsha mentioned, free of charge these services. Doctor, I'm not going to take much of your time. If you could give us the general introduction to tell what the Health Promotion Bureau is doing, the state is doing with these private entities, and bringing up the kind of technology that most people haven't seen for quite some time.
Yeah. So Health Promotion Bureau per se is set up for a particular purpose. So it's not just health education, but it's to empower our people. So we are trying to give the power back to the people to have control over their health. So to do that, one of the prime things would be provide them access to good information and to give them the ability to decide for themselves what's good for them. So the first step in that is to reach out to the most vulnerable populations, because a lot of people think the moment you say telemedicine, okay, it's for people who can afford it. No, actually these technologies are developed so that we can take it to the people who have to travel 5 kilometers or for a few hours to get to a hospital, where they can simply use a smartphone of their own, or if they don't have access, probably a smartphone of someone who does have access to these things. So if we are talking about universal health coverage or health for all, and providing it for the most underprivileged populations, we have to think about these technologies to take it to the villages. So in that area, the private sector has done a fantastic job. You won't even believe the kind of, even Beshan Kulapal from Vega, right, who's been building supercars, right? And these technologies we are talking about are nothing not so big compared to that, but he has come forward. You have seen the ventilator that was created, and apart from that, he is discussing with us on how to develop pods where you can have basic telemedicine portals, right? So which can be even airlifted and dropped at a certain place. And these are places where we can increase the reach of these facilities. So it's not just the tech people, the health, even politicians, the young politicians have come forward and helped us, not in their usual capacity, but offered to help us even to, write letters, right? And nobody expected even their name mentioned on anything. They didn't take even a photograph, right? So this is the Sri Lankan attitude that we need to cultivate. Nobody came here for the glory, right? The private sector companies like Arimac is running our website. I mean, they're doing a fantastic job, but they do not even ask any incentive in return. So likewise, we have so many other private sector people who are working with us, some discussing the possibility of using the drone technology to transportation and things that we thought are never possible in Sri Lanka. Believe me, if we use this as a platform to grow, Sri Lanka will be reaching heights that was never thought possible previously. So I think we should use it for advantage so that the private sector and the government sector can get together. Because we all have the common thing. Now we talk about the healthcare sector. Now we all realize when we are in trouble, right, at this point, it is the government hospital that's providing care, whether you are the richest guy in Sri Lanka or the poorest person. It will be the hospital system, and we will never back down. Let it be even worse than this. This system we all need to preserve. And I hope the private sector enthusiasm that has been developed up to now will continue to develop our health sector to be the best in the world. We are already among the top, because the amount of investment is low, but the outcome wise, if you look at the statistics, that's why all the UN organizations are saying Sri Lanka is a model for other countries to follow on how we set up the system. So let's use this opportunity, the private-public partnership, to take it to the next level and become the best healthcare system in the world.
On that note, Dr. Harsh, if I come back to you before we go into a small break, there is a lot of admirable, a lot of efforts that the state are taking, even like the sectors where it is involved with awareness, they're taking it very seriously, and they're taking steps forward. Doctor, if you could give us your take on how people are functioning when it comes to this, and where you think, because you have been working on this platform as well, and you mentioned this to us on our previous programs, where do you think we can head from this point onwards? Do you think we are going to have more involvement from people? Do you think people will actually take it more seriously in the near future? Because the pandemic, something that we should keep in mind is the pandemic and the focus on the coronavirus is very important, but there are a lot of other people who are at their homes who suffer from another host of diseases as well, who need the help of this kind of enthusiasm to continue. Doctor, what do you like, taking those things into consideration, Doctor, where do you think we'll head in the future?
Yeah, I think Sri Lankan people are taking up this new technology very well. Actually, even people who doesn't have a smartphone, they have a normal phone where they can speak to, there are certain hotlines where they can speak to a doctor at any given time. And even the smartphone is now, as Dr. Ashan told, it's 40 to 50% penetration is there. So we see people are using this. We see a lot of video consultations are being used. We see a lot of audio consultations are used. We see a lot of pharmacy deliveries are used through these apps. So people are taking up this. And also because of this government involvement, there is a good governance also, where this streamlining of these certain services, so they keep an eye on this, as I told you last time in the program. So the governance is also plays a role here. So there's this Health Ministry, Health Information Unit, they actually governs these applications and see what to be done, what to be added, and how to make it user-friendly to people. So these type of things are also going on. So then these will make people use these type of softwares, use this type of apps in the future. Especially when you get used to this, when a person repeatedly one or twice do certain, use these type of apps, then they will get used to this. Even in the future, they will use these apps before going to a doctor to clarify certain things. Because in US there's a research done where 70% of people does not need to physically go and meet a doctor sometimes, because what they need may be advice about a drug, what to do, about a side effects, or what next to do, what investigations to be done. So these type of advices can be done through telemedicine. So people will get used to this, as you asked me.
I think that's a very good note to take a very short break, and then we'll move to the most conclusive part of our discussion. We have covered a lot of areas pertaining to like the steps that have been taken both by private and public entities. On that note, a very short break to our viewers, after which we'll be back on to our last segment on today's program. Here with Gen XYZ. Stay with us.
This is Ada Derana's continuing coverage on the coronavirus crisis. This is Ada Derana's continuing coverage on the coronavirus crisis.
Welcome back to Gen XYZ. We are in our last segment. I would like to start with Dr. Harsh Jayakodi itself, and something that you have brought to the general public within our country, Doctor, is the My Doctor application. You founded it, and based on that, there's a large reach. It is doing a service, and then at this point of time, it's introducing things that are very much important, which what Dr. Ashan also was mentioning from the very beginning. Doctor, if you could give us an introduction to give us the kind of mandate that it's following as well, and then move into a more conclusive part and give the message that you wish for the public, the audience that is like joining us right now, to take from all of this. Where can they be heading? Because the issues that people have, it could be disabilities, it could be other wide range of problems in today's society. So they need the reach to come to their homes, their doorsteps, and that is what is essentially being discussed here today. So Doctor, a message that you would like to give as on a conclusive note.
So Danidu, My Doctor is a telemedicine platform. It was founded in 2012 in a different name, but with the involvement of investors, and it has come to a stage where now it has been nationwide. My Doctor can be accessible by anyone. So it's an app as well as a website. So through this app, people can talk to a doctor, audio, video, or even a chat. So with this COVID-19, we have made everything free of charge. And also with the government involvement, there's a free portal where government doctors also can be consulted through this free portal, where especially government doctors who are involved in government sector can be talked and get things cleared with this app. And also, if a person wants to get their medicine delivered, these type of apps, so My Doctor app can be used to get medicine delivered. So these are the telemedicine aspects of My Doctor. So My Doctor has been there for now nearly 8 years, with the various involvement. And then what I see is, especially now the people are using this, because those days people are not reluctant to use. Some people, because they don't know what type of things, when you speak to a doctor through internet, you don't know to whom you are speaking, or sometimes you may have certain doubts. But now with this COVID-19, people have been using this, and then when you use this to get your certain health advices, you feel the comfort. You feel the comfort where you can talk to a doctor from your home. So your traveling time is reduced, your money for unnecessary things are reduced. So you get the convenience with these type of apps.
On that note, Doctor, something before we go to Dr. Ashan, are there barriers that you're facing, Doctor, like when it comes to medicine in general, or taking this message across in any particular, in very conclusive note, are there barriers that you witness as a message that you would like to bring to like the people to keep these things in mind? What would you like to suggest on a very last note?
Yeah, actually, what the way the people think should be changed. Actually, I think with this pandemic, people are changing. So people used to think that sometimes only the physical meeting with a doctor can solve problems. That is how we were even taught. But with this pandemic, with this technology getting involved, people are now used to see a doctor even virtually. So virtual hospitals may be coming up. So virtually you can speak to a doctor. Virtual doctor meetings can be happen. Even for elderly people who can't visit hospital, even you can speak to a doctor virtually, or even you can speak to a psychologist virtually, which will be a very good added advantage for these people.
Right. On that note, Dr. Ashan, if you could give us a more conclusive line for the thoughts that we have been discussing today pertaining to the Health Promotion Bureau, the steps it's been taking, where do you see us going in the future, and what kind of message you'd like to give?
Yeah. I think, this has been a disaster for the entire world, right? A lot of people are suffering from it. They are predicting a lot of bad things, right? They don't know when the economy would start. But if you look at Sri Lanka, we have been a really resilient country. We have seen worse things. We have experienced worse things. But one particular thing about the Sri Lankans is, even though we fall, we rise better than the situation. So I think Sri Lanka has to use this opportunity and look at this as a platform for us to rise to a higher standard, because we have seen good things. I told you how the politicians have changed the way they are thinking. They are no longer running after the personal glory. So many people have supported without even mentioning their names. The private sector has come forward. We have all realized things, that the barriers that we developed previously are no longer existing, right? We are all the same. We are all going to die one day. So people have developed a lot during these last few months, and I think we can take it forward because we have a strong political commitment, not only recently but throughout the years. Sri Lanka has maintained this free healthcare service. That's what some countries have fallen behind. It should not differ. That's a universal acceptance that people should have equal access to healthcare. Right? So Sri Lanka has maintained it, and we have a very good grassroots level approach where we can reach out to every single person in the community through our public health system, which is one of the best in the world. And we are seeing the benefits of it, where we have our PHIs, our PHMs, our medical officers of health operating these stations, reaching out and doing a fantastic job, which the other countries are falling behind. We are still tracing down contacts. right? People usually give up after about 100 patients. We are still doing it. That's why we are still having a firm control on this. So I think Sri Lanka is well placed to make the maximum use of this situation and to rise to a better situation. I hope we will have a transformation where the government, the people and the health system will work towards establishing a fantastic system for our people.
Doctor, on a very final note, if you could, in seeing where we are heading from this point onwards, I believe you have given us some context as well as to the kind of private entities that are getting involved. A very few seconds that we can use for the final part of the program to understand what do you think, on a personal note, what you have witnessed as the most important signs in this private involvement, in the involvement of other people. What are those core things that we should take as lessons learned from this pandemic and move forward, Doctor?
So one of the main things would be the empowerment, and people have started realizing that health is a part of them. Like all this time people are running behind, glory, the assets, the money, and all of a sudden people have realized I have to live first. So people are now going back to those roots, and people will focus hopefully more on their health and how to improve it, and not just take our advice. That is a very native, but to take responsibility and go behind to understand more about themselves. If you're having a car, you would learn about the car. Just like that, you have a body which is a machine that you need to know a lot. So I hope Sri Lanka will go to the next level of taking responsibility and becoming a healthy nation.
Right. I think on that note, I thank both our guests for joining us. It was a very important discussion, a very discussion that is required at this kind of time. And I believe our viewers will get a lot of these messages to themselves and get a better understanding. On that note, I thank our guests again. I thank our viewers for joining us. Join us again and we bring back something more contemporary pertaining to this crisis, pertaining to the place where the country is going. On that note, I thank again our viewers for joining us. We will join again. This has been Gen XYZ. I'm Danidhu Tanwasan. Thank you for joining us.
This is Ada Derana's continuing coverage on the coronavirus crisis.